In this lecture, we are going to discuss the clinical manifestations of the herpes simplex virus type 1. Before discussing the manifestation, we should have to know about the three most important stages of the herpes simplex virus type 1. First is the primary stage, in which you will see the person will get the herpes simplex virus type 1 for first time, and as a result you will see the primary infection. After that, the virus become inactive in the neuron, and as a result you will see the latent stage of the herpes simplex virus type 1. And when the virus gets some stimulus like the fever, trauma, heat, sunlight, and the hormonal changes, then you will see the activation of the virus from the latent stage, and that stage is actually called the recurrent stage. So there are basically the three most important stages: primary, latency, and the recurrent. Okay, now first of all, we will look at the primary infections of the herpes simplex virus type 1, and that is actually the gingivostomatitis. Gingivostomatitis means inflammations of the gums and the mucosa of the mouth. That infection is actually a primary infection. Primary infection, and it is mostly seen in the children. That is actually mostly happens in case of children. And in the gingivostomatitis, you will see the vesicular lesions in the mucosa of the mouth. You will see the vesicular lesions inside the mouth, and in that case you will see the vesicular lesions heals spontaneously in 2 to 3 weeks. Okay, but important thing which you have to remember, that the primary infection is more severe than the recurrent infections, and in most cases gingivostomatitis is basically asymptomatic. When the symptoms appear, then you will see the gingivostomatitis. Okay, next is the orolabial herpes, which is also known as the fever blister. Fever blister, or another name for the orolabial herpes is actually the cold sore. Cold sore. Basically, fever and the cold is actually a stimulus for the herpes simplex virus type 1. And orolabial herpes mostly seen in the recurrent phase. Okay, that is the result of the recurrent phase of the herpes simplex virus. And in the orolabial herpes, you will see the vesicles at the mucocutaneous junction of the mouth, or you can say lips, and the nose. That specifically these lesions form at the mucocutaneous junctions of the lips. And there are a lot of stages of the vesicles. First of all, you will see the erythema, then you will see the formations of the papule. After that, you will see the vesicle, and from the vesicle you will see, when the vesicle rupture, you will see the ulcer formation at that side, and ultimately you will see the crust form, that is the recovery form of the vesicle. Okay, there are basically the different stages of the vesicles. Okay, next is the herpetic psychosis, which is also known as the HSV, herpes simplex virus folliculitis. That is actually the folliculitis. Inflammations of the hair follicles, and it is mostly seen in male at the beard side when the male come in contact with the razor, and as a result you will see the folliculitis due to the herpes simplex virus. Okay, next is the keratoconjunctivitis. And the keratoconjunctivitis, that is actually ocular herpes simplex virus infection, you will see two most important infections. First is the cornea, and second is the conjunctiva. Keratoconjunctivitis, you will see the ulcer formation in the cornea, and you can also see the lesions in the conjunctiva. So that is actually the keratoconjunctivitis. An important thing, herpes simplex virus type 1 mostly form lesions at the upper part of the body, but the herpes simplex virus type 2 forms lesions at the lower part of the body. So these are basically the upper part of the body. Okay, if you see the reactivations of the virus repeatedly, then you will see the scarring, or you can say the blindness of the person. Okay, next is the encephalitis, brain infections. In that case, you will see the necrotic lesions in the temporal region of the victim. Okay, you will see the necrotic lesions specifically in the temporal region, and that is mostly seen in the MRI report. Another important thing, what symptoms you will see during the encephalitis? You will see the fever, vomiting, headache, seizures, and the altered mental status. Here are basically the different symptoms seen during the encephalitis caused by the herpes simplex virus. And in the CSF report, you will see the moderate elevations in the proteins. You can also see the increase in the count of the lymphocytes, but the glucose level will be normal in that case. So here are basically the different features of the encephalitis caused by the herpes simplex virus type 1. Next is the herpetic whitlow. In that case, you will also see the lesions, but at a specific part of the body, and that will be the skin of the finger and the hand. In that case, you will see the vesicular lesions at the finger or the hand, and it is mostly seen in the medical personnel when they are in direct contact with the patient's lesions, and they can also be seen in the children who suck their fingers. Next is the herpes gladiatorum. In herpes gladiatorum, you will see the vesicular lesions at the head, neck, and the trunk region. And this is mostly seen in the wrestlers or those who are in direct contact with the other person. This is mostly seen in the wrestlers. That is the herpes gladiatorum. And the vesicles will seen on the head, neck, and the trunk. Okay. Next is the eczema herpeticum, which is also known as the Kaposi's varicelliform eruption. Okay. Another name of the eczema will be the Kaposi's varicelliform eruption. In that case, you will see the infection at the atopic dermatitis side. Okay, you will see the herpes virus infection at the atopic dermatitis site. The infection will happen exactly at the site of the atopic dermatitis due to the breakage of the skin barrier. And as a result, the herpes simplex virus get chance to cause infection at that site. That's why it is also known as the eczema herpeticum. Next is the disseminated infection, and this is mostly seen in immunocompromised patients. And in that case, you will see the two most important things: esophagitis, inflammations of the esophagus, and you can also see the pneumonia in that case in immunocompromised patients. Next is the neonatal. Important thing, herpes simplex virus type 1 will enter into the neonate after the birth, but the herpes simplex virus type 2 infect the neonate during the birth, because herpes simplex virus type 2 affects the genitals, or you can say birth canal, and as a result, baby can or neonate can get the herpes simplex type 2 at that site. But the herpes simplex type 1 enter into the neonate from the other persons, and as a result, you will see the neonatal herpes simplex virus infection. And in that case, you will see the disseminated cutaneous lesions, and you can also see the ocular eye herpes infections, or you can also see the mouth herpes infection in that case. And you can also see the encephalitis in that case when the herpes virus enter into the brain of the neonate. That is actually the neonatal herpes simplex virus infection. Next is the genital herpes. Genital is actually a lower part of the body. Then how herpes simplex virus type 1 entered into the genitalia? The answer is basically due to the genital oral contact, or you can say oral sex. Due to the oral sex, you can see the herpes simplex virus type 1 from the saliva enter into the genitalia, and as a result you will see the genital herpes. You will see the two types of the oral sex, fellatio and the cunnilingus. In fellatio you will see the stimulation of the male penis through the mouth, and in cunnilingus you will see the stimulations of the vagina through the mouth. And as a result, the herpes simplex virus type 1 from the mouth affect the genitalia and cause the genital herpes. And in that case, you will also see the vesicular lesions. So this is all about the clinical manifestation of the herpes simplex virus type 1. If you still have any question, you may ask in the comment section. Thank you so much.